For more expert insight now on the state of the global pandemic, we're going to bring in Dr. Jay Wolfson. He's a distinguished service professor of public health, medicine, and pharmacy at the University of South Florida Health. Good to see you, doctor. And you know, walking around the streets here in D.C. and taking planes and trains, I mean, it doesn't feel like it's a pandemic. Well, where are we?
Well, most of us think that we're in what we consider an endemic phase of this, where it's become more common, kind of like what influenza has become and the common cold, except that we know that this thing can change. It can vary. It can move itself into something that it wasn't. We're just hoping that the combination of natural immunity and vaccinated immunity that we've gotten is going to make it less likely that more people are going to die. Now, the rate of disease in the population is still high. We're having lots of new cases, and we're having breakthrough cases as well, Phil. That's very important. Those are people who've been vaccinated, people who got their boosters, and they still get sick. Even young, healthy people. My own son and my daughter-in-law have gotten pretty sick these last few months, even though they were fully vaccinated. There's something else that we've talked about, and that is post-infection chronic syndrome. Many people who get the disease naturally run the risk of some later lung disease, heart disease, kidney disease, or brain disease, what's often called long hauler syndrome, and that doesn't seem to go away very well. So hopefully we've learned an awful lot about how to manage the disease, because we're not having the same death rate we had, but as you have more people getting the disease, either for the first time or over again, it will spread and some people will get sick. Vaccinations and natural immunity reduce the likelihood of severe illness and death.
I was reading earlier, I think it's now 3 days in a row now that we've had 100,000 cases. Correct me if I'm wrong. And
well, you're right.
I'm just curious, when do we panic? Or are we done with the panicking? Or should we panic?
I don't think panic is the right response. I think we have to look at what counts politically and in terms of our system's capacity to deal with it. And unfortunately, or quite frankly, that's people dying. As the death rate and the numbers of death remain relatively low, it gets treated more like another disease, another infection, albeit a severe one. And until deaths begin to increase, we're not likely to see an aggressive response. And, you know, we're not going to see an easy national response, because public health in the United States is generally not a federal issue. It is state controlled. Every state, like the Constitution, is really responsible for managing its own public health.
Fair enough, but if you've been on a plane, that goes state to state. No one's wearing a mask. Okay, very few people are wearing a mask.
That's right.
Except for in very crowded situations. And I just think that if as a regular public citizen, if the government's not panicked about it and the state officials are not panicked about it, and they're not watching this show, then I don't see how you can expect them to be on guard for the virus.
Well, the bottom line has always been, Phil, since the beginning of this pandemic, that in this country we can't expect the government to do an awful lot for us or to us. It's really a matter of personal responsibility and common sense. We know how the disease is spread. It's spread by expressing, coughing, sneezing, talking, yelling, screaming, singing. And if you're at high risk and you're in a place that the air is not very well controlled and it's crowded, you might want to wear a mask. If you're on an airplane and you're at high risk, you might want to wear a mask. Again, it's a common sense thing, and each of us needs to be responsible for protecting our own health. You wouldn't go in.
Doctor, very quickly, I'm almost out of time. Just a very quick question. Where are we on vaccination rates? And if somebody does test positive for COVID or suspected COVID, what are they supposed to do? Still isolate at home?
Yes. If they're testing positive, treat it as if you've got the disease and you're still going to be contagious for your family members, for your friends, and for your coworkers. The same rules should apply if you're positive. Absolutely.
Okay. Doctor, thank you for your insights on this. Dr. Jay Wolfson from Florida, thank you very much. We'll look forward to having you again on this topic.
Be well and be safe, Phil.